Today we'll explore an important and effective method for eliminating dental plaque and tartar. This is an expanded approach that adds a critical ingredient to the formula, vitamin C. Vitamin C plays a crucial role in oral health. While you may know vitamin C as ascorbic acid, that's actually just one component of the complete vitamin C complex found in nature. However, ascorbic acid can be effective in helping eliminate plaque. The connection between vitamin C and oral health is often overlooked in conventional dental advice. Most people focus solely on brushing techniques or commercial mouthwashes, missing this fundamental nutritional component. What makes vitamin C particularly powerful is its dual role as both a structural support for gum tissue and a defense mechanism against harmful microorganisms in the mouth. Scurvy, a severe vitamin C deficiency, offers important insights into oral health. Historically, sailors developed scurvy due to lack of vitamin C-rich foods during long voyages. They discovered that consuming limes, lemons, onions, and even potatoes could cure this condition. The symptoms of scurvy progressed in a predictable pattern, with oral manifestations appearing early. Sailors would first notice bleeding, swollen gums that would recede from the teeth. Their teeth would become loose and eventually fall out. This progression demonstrates the critical relationship between vitamin C and the integrity of oral tissues. British naval physician James Lind conducted one of the first clinical trials in medical history in 1747, proving that citrus fruits could prevent and cure scurvy. This discovery was so significant that British sailors became known as limeys because of their regular consumption of lime juice to prevent the disease. Why vitamin C matters. Vitamin C is essential for collagen production throughout the body. In skin, bone tissue, teeth, ligaments, tendons, muscles, joints, and blood vessels, including capillaries. Without sufficient vitamin C, capillaries become fragile, leading to bleeding gums. Gingivitis and periodontal disease often indicate a vitamin C deficiency. At the molecular level, vitamin C provides the hydroxylation of proline and lysine in procollagen, which is necessary for the triple helix structure of collagen to form correctly. Without this critical step, collagen fibers remain weak and unstable. This explains why gum tissue deteriorates so quickly in vitamin C deficiency. The collagen matrix that provides structural support begins to fail. Additionally, vitamin C plays a crucial role in the differentiation and function of osteoblasts, the cells responsible for bone formation. This impacts the health of the jawbone and the sockets that hold teeth in place. Studies have shown that individuals with higher vitamin C intake tend to maintain better bone mineral density in their jaws as they age. Sugar feeds bacteria that produce acids, causing cavities, inflamed gums, plaque, and tartar. These bacteria metabolize sugars through fermentation, producing lactic acid as a byproduct. This acid demineralizes tooth enamel by dissolving calcium and phosphate ions, beginning the process of cavity formation. The acid environment also favors the growth of pathogenic bacteria while suppressing beneficial ones, creating a downward spiral of oral health. What is tartar? Tartar consists of biofilms, colonies of microbes that band together, forming calcium igloos or shelters to hide from the immune system. In nature, 90 to 95% of bacteria form biofilms. These protective formations appear as slime on rocks in streams, as tartar on teeth, as plaque in arteries, and as calcium deposits in joints. The development of tartar follows a precise sequence. First, a sticky film called pellicle forms on teeth within minutes after brushing. Bacteria attach to this film within hours, beginning to form a biofilm community. As these bacteria multiply, they communicate through a process called quorum sensing, coordinating their activities and strengthening their defenses. Within 48 hours, calcium and phosphate minerals from saliva begin to harden the biofilm into calculus or tartar. This mineralization creates a permanent shield that conventional brushing cannot remove. The rough surface of tartar then provides an excellent surface for more bacteria to attach, accelerating plaque accumulation. Mature tartar harbors hundreds of bacterial species in a complex ecosystem. These bacteria release endotoxins that trigger inflammation in surrounding gum tissue. The physical presence of tartar also creates pockets between teeth and gums where oxygen levels are low, favoring the growth of anaerobic bacteria associated with periodontal disease. Vitamin C benefits beyond teeth. Without adequate vitamin C, you might experience bad breath from bacterial overgrowth, reduced ability to fight pathogens, viruses, bacteria, yeast, fungus, mold, and biofilms. Allergic reactions. Vitamin C acts as an antihistamine. Weakened connective tissue. Decreased folate activation. Impaired conversion of cholesterol to bile salts. Reduced conversion of tryptophan to serotonin and dopamine to epinephrine. Decreased production of adrenal hormones. Greater susceptibility to infections and biofilms. The relationship between vitamin C and immune function is particularly relevant to oral health. Neutrophils, the white blood cells that form the first line of defense against invading microorganisms in the mouth, require high concentrations of vitamin C to function properly. These specialized immune cells actually accumulate vitamin C at up to 100 times the concentration found in plasma. Vitamin C's role as an electron donor makes it an essential antioxidant throughout the body. In the oral cavity, this antioxidant function helps neutralize free radicals produced during inflammatory responses to bacteria. This modulates the inflammatory process, preventing excessive tissue damage while still allowing the immune system to fight infection. The connection between oral health and systemic conditions becomes clearer when we consider vitamin C's wide-ranging effects. Poor oral health has been linked to cardiovascular disease, diabetes, and even Alzheimer's disease. By supporting oral health through optimal vitamin C levels, we may be contributing to whole-body wellness. Ships historically developed barnacles, collections of organisms with calcium shells that added tremendous weight and resistance. This marine fouling required a third more fuel to overcome. Various toxic chemicals and paints were tried as solutions. In 1990, a sailor eating a sandwich with hot chili peppers had a brilliant idea. Could chili peppers kill these barnacles? He discovered they did and developed a paint using chili peppers that worked effectively. Chili peppers not only contain compounds that kill biofilms but are also very high in vitamin C. Vitamin C can transform into hydrogen peroxide, another anti-biofilm agent that our bodies naturally produce. The active compound in chili peppers, capsaicin, disrupts quorum sensing, the communication system bacteria used to coordinate biofilm formation. This mechanism is remarkably similar to how certain compounds affect dental biofilms. The discovery revolutionized the marine industry, creating environmentally friendly anti-fouling paints that didn't leach toxic compounds into the ocean. This cross-disciplinary insight reveals a fascinating pattern in nature. The strategies that work against biofilms in one environment often work in others. The mouth, with its warm, moist environment and constant nutrient supply, provides ideal conditions for biofilm formation similar to a ship's hull in seawater. Understanding these parallels helps develop effective approaches to managing dental biofilms. Formula for tartar removal. Here's an improved 4-ingredient formula. Dissolve 1/4 teaspoon of baking soda in half a cup of warm water. Add 1/4 teaspoon of 3% hydrogen peroxide. Add 1/4 teaspoon of non-GMO ascorbic acid. Optional. Add peppermint or clove essential oil for better taste. Brush teeth thoroughly with this mixture once daily, both inside and outside surfaces, then spit and rinse. Let's examine why each ingredient in this formula works so effectively. Baking soda, sodium bicarbonate, creates an alkaline environment with a pH around 8.3. This neutralizes the acids produced by bacteria and disrupts their metabolism. The mild abrasive nature of baking soda helps physically remove biofilm without damaging enamel. Studies have shown that baking soda penetrates deeper into biofilm matrices than many commercial ingredients. Hydrogen peroxide, 3%, works through oxidative stress. When it contacts organic material, it breaks down into water and oxygen, creating bubbling that mechanically disrupts biofilms. The released oxygen creates an environment hostile to anaerobic bacteria that thrive in periodontal pockets. Hydrogen peroxide also denatures bacterial proteins and damages cell membranes. Ascorbic acid, vitamin C, works on multiple levels. Its acidic nature helps dissolve mineral deposits in tartar, while its antioxidant properties support tissue healing. Ascorbic acid chelates calcium, helping to soften calcified deposits. The conversion of ascorbic acid to dehydroascorbic acid generates hydrogen peroxide as a byproduct, enhancing the antimicrobial effect. Essential oils like peppermint and clove contain compounds with proven antimicrobial properties. Eugenol in clove oil has been used in dentistry for centuries due to its analgesic and antibacterial properties. These oils penetrate biofilms effectively due to their lipophilic nature, reaching bacteria hidden within fatty matrices. Best foods for healthy teeth and gums. To maintain oral health, regularly consume foods high in vitamin C. All varieties of peppers, red, hot, mild, green. Green vegetables. Fresh limes and lemons, not pasteurized juice, as vitamin C is sensitive to oxygen and heat. Fermented cabbage, sauerkraut. The vitamin C content in foods varies significantly based on growing conditions, storage, and preparation methods. Bell peppers contain approximately 95 milligrams of vitamin C per 100 g, with red peppers containing more than green ones. A single medium red bell pepper can provide over 150% of the daily recommended intake of vitamin C. Hot peppers offer a double benefit. Their capsaicin content disrupts biofilms while their vitamin C supports tissue integrity. Interestingly, smaller hot peppers often contain more vitamin C by weight than larger varieties. Cruciferous vegetables like broccoli, kale, and Brussels sprouts provide not only vitamin C but also sulfur compounds that may help control oral bacteria. Broccoli contains approximately 89 milligrams of vitamin C per 100 g. Citrus fruits are well-known vitamin C sources, with lemons containing about 53 milligrams per 100 g and limes about 29 milligrams per 100 g. The bioflavonoids in citrus fruits work synergistically with vitamin C, enhancing its effects. When consuming citrus, be mindful of their acidity. Rinsing with water afterward helps protect enamel. Fermented foods like sauerkraut offer a unique advantage. The fermentation process preserves vitamin C while creating beneficial probiotics. These probiotics can help rebalance the oral microbiome, potentially crowding out harmful bacteria. Traditionally fermented sauerkraut can contain up to 35 milligrams of vitamin C per 100 g. For optimal benefit, consume these foods raw or minimally cooked whenever possible. Vitamin C is water-soluble and heat-sensitive, with significant losses occurring during cooking. Steaming or quick stir-frying preserves more nutrients than boiling or prolonged cooking. Understanding the difference between natural vitamin C complex and synthetic ascorbic acid is crucial for complete dental health. Incorporate these approaches for healthier teeth and gums. Natural vitamin C complex, as found in whole foods, contains not just ascorbic acid but also bioflavonoids, tyrosinase, copper, and other cofactors that enhance absorption and effectiveness. These components work synergistically in ways that isolated ascorbic acid cannot replicate. When using ascorbic acid in the tartar removal formula, it's still beneficial despite being just one component of the complete complex. However, for internal consumption and overall health, prioritize whole food sources whenever possible. The relationship between oral health and systemic wellness cannot be overstated. The mouth serves as both a window to overall health status and a potential gateway for infection. By maintaining optimal oral health through proper nutrition and targeted care, we support the entire body. Implementing this vitamin C-enhanced approach to tartar removal represents a return to fundamentals, addressing the root causes of dental issues rather than just their symptoms. By combining modern scientific understanding with nature solutions, we can achieve dental wellness in harmony with our body's design. Remember that consistency is key. Dental biofilms begin forming within hours after cleaning, so regular care is essential. Combined with a nutrient-dense diet low in refined sugars and high in vitamin C-rich foods, this approach offers a comprehensive strategy for lasting dental health.